The major muscles of the body. As you can see on the picture, on the left is the muscles from the front, and on the right is the muscles from the back. There are many different types of muscles within the body and many different joints that make them up. Within the shoulder joint, when the agonist is the anterior deltoid and the antagonist is latimus dorsi, the movement is flexion, the origin is clavicle and scapula, and the insertion is in the deltoid. When the agonist is the posterior deltoid and the antagonist is the latimus dorsi, the movement is extension, the origin is clavicle and scapula, and the insertion is in the humerus. When the agonist is the medial deltoid and the antagonist is the latimus dorsi, the movement is abduction. The origin is in the clavicle, scapula, and acromion. The insertion is in the humerus. When the agonist is the latimus dorsi, the antagonist is the deltoid. The movement is adduction, rotation, and extension and flexion. This happens in the origin of the lumbar, ilium, and thoracic vertebrae, in the insertion of humerus. When the agonist is the rotator cuff muscles and the antagonist is the deltoid, the movement is abduction, which happens in the origin scapula. The insertion is the humerus. When the agonist is the pectoralis major and the antagonist is the latimus dorsi, the movement is rotation, which happens in the origin, ribs, sternum, and clavicle, and the insertions in the humerus. And the radio-ulnar and elbow and knee joint, when the agonist is the supinators, the antagonist is the pronator teres, the movement is supinator's forearm, the origin is lateral epicondyle of humerus, and the insertion is lateral proximal radial shift. When the agonist is the pronator teres and the antagonist is the supinators, the movement is pronation of the forearm, the origin is medial supracondylar ridge of humerus. The insertion is the middle lateral surface of radius. When the agonist is biceps brachii and the antagonist is triceps brachii, the movement is flexion, the origin is scapula, and the insertion is radial tuberosity. When the agonist is triceps brachii and the antagonist is biceps brachii, the movement is extension, the origin is scapula, and the insertion is olecranon process of ulna. When the agonist is hamstring and the antagonist is quadriceps, the movement is extension in the hip, flexion in the knee. The origin is tuberosity of the ischium. The insertion is tibia and fibula. When the agonist is quadriceps and the antagonist is hamstrings, the movement is extension in the knee and flexion in the hip. This happens in the origin rectus femoris and the vastus muscles. The insertion is the tibial tuberosity. In the hip joint, when the agonist is iliopsoas and the antagonist is gluteus maximus, the movement is flexion, the origin is iliac fossa and lumbar. The insertion is lesser trochanter of the femur. When the agonist is gluteus maximus and the antagonist is iliopsoas, the movement is external rotation and extension. The origin is gluteal surface of ilium, lumbar, fascia, sacrum, sacrotub, eros, ligament. The insertion is gluteal tuber, femur, and iliotibial tract. When the agonist is gluteus medial and minus, and the antagonist is adductors, The movement is abduction and adduction. The origin is gluteal surface of ilium under gluteus maximus, and the insertion is greater trochanter of the femur. When the agonist is adductors and the antagonist is gluteus medial and minus, the movement is adduction, the origin is pubis, and the insertion is femur and tibia. When the agonist is tibius anterior and the antagonist is gastrocnemius and solus, the movement is dorsiflexion, the origin is the lateral surface of the tibia, and the insertion is the medial cuneiform and the base of the first metatarsal bone of the foot. When the agonist is gastrocnemius and soleus, and the antagonist is tibialis anterior, the movement is plantar flexion. The origin is lateral condyloid and femur, and the medial condyloid of femur, and the insertion is Achilles tendon. In the spine, when the agonist is the internal obliques and the antagonist is the external obliques, the movement is ipsilateral trunk rotation and compressed abdomen. The origin is inguinal ligament, iliac crest, and the lumbar dorsal. The insertion is pectineal line of pubis and ribs 10 to 12. When the agonist is external obliques and the antagonist is internal obliques, the movement is flexion of torso. The origin is ribs 5 to 12, and the insertion is outer lip of the iliac crest, pubic tubercle, and linea alba. When the agonist is rectus abdominis and the antagonist is erectus spinae, the movement is flexion of lumbar. The origin is crest of pubis, and the insertion is costal cartilage of ribs 5 to 7. When the agonist is erectus spinae and the antagonist is rectus abdominis, the movement extends the vertebrae column. The origin is T9 to T12 of the thoracic vertebrae, and the insertion is T1 to T2 of the thoracic vertebrae.